Doctors at the hospital and even athletes in the Olympics reminding us the importance of putting mental health first. That's a big part of this component.
If you don't, then you're not going to enjoy your sport and you're not going to succeed as much as you want to. So it's okay sometimes to even sit out the big competitions to focus on yourself, because it shows how strong of a competitor and person that you really are.
Now, we saw this week Team USA gymnast Simone Biles withdraw from team competition on the world stage because she says she wasn't in the right headspace. She's not the first superstar to make this kind of move on an international stage. Naomi Osaka stepped away from the French Open this year, citing depression and anxiety. Dr. Allison Chase is a clinical psychologist with Pathlight Mood and Anxiety Center here in Austin. Thanks for being here with us.
Sure, thanks for having me.
What was your reaction when you saw Simone Biles step away from competition this week?
It was twofold. On one hand, my heart went out to her because there's no doubt she must be suffering significantly. And as well, I was so glad that she was highlighting and illuminating the fact that mental health and challenges, emotional challenges, impact everyone, even the greatest of all time, right? So it's really important to recognize that nobody can escape it, and it is so important to be able to bring attention to it, so that there are many millions that are suffering all the time. And so I really applaud those that are willing to take a stance to talk about it.
There are so many people under increasing pressure right now. Stresses, the thought of wearing masks again with school getting ready to start. How do we help our kids through all of this?
It's really hard. Well, you really need to give your children also a space to talk about it. I think that is always an important conversation to have, to acknowledge the fact that the anxiety, the stress, the wariness of it all is very real, and it's very scary at the same time. So super important to be able to have a conversation and to talk about it. And it's really important, especially with your kids, to be looking for the kind of signs that we worry about, which is significant change in behavior. So that might be sleeping, it might be eating, their mood might shift, their interactions with their peers. I know it's been an odd sort of year and a half, so I know what is normal is a little bit different now, but it's really important to clue into those factors, because you do not want to miss early signs of mental illness.
Is it important too? I mean, I think about like our news business. It's hard for us sometimes to get away from it. In this business, it's hard for medical professionals to get away from it. What kind of recommendations do you have for people who are in that bubble all the time?
It is really hard. So yes, I think when you can sort of put down all the extra information for a moment is really important. I also think it's really important for self-care. And what do I mean by that is being able to utilize those that you support, your network, to be able to talk to be able to have enjoyable time and conversation with, where you're allowing yourself just to sort of take a minute to revive yourself again, right? To be able to gain the strength. I heard earlier that, speaking to frontline workers that are just exhausted, and we get that in the mental health profession. We're seeing so much as well. And so it's really important when you can take a minute to take care of yourself, because that's the only way that you're going to be able to do the job that needs to be done to take care of those that need you to.
I know adversity is kind of an important thing for us to learn how to deal with. There's been some discussion that maybe we as parents are partly to blame for how our kids kind of handle situations like this. So is there a way for us to kind of set up those situations that will make them be able to, better prepare for events that may come into their life in the future?
Oh, you've asked a magical and such an important question. And I say that because I could not agree more about how important it is for parents to be thinking about setting their children up to be successful as they move into adulthood. And that starts at a really young age. So what it means is having kids try things out, right? Try out the things that make them uncomfortable, that maybe make them a little bit nervous, that even simple things like, having to go sort of ask a question by themselves, or having to do something of that nature, where they're being supported and they're being guided, but they're doing something that's a little bit scary. What it does is it ends up teaching children that they are capable and that they are able to handle these really uncomfortable situations. And you continue to do that at what we would call developmentally appropriate stages, kind of depending on the age that they are. But you'll find that you will end up with children that are much better able to handle what we call emotional tolerance when situations are really, really challenging, as opposed to shutting down and not wanting to fulfill it.
Dr. Allison Chase, a clinical psychologist with Pathlight here in Austin. Thanks so much for joining us.
Thank you.
Great information.